Family physicians provide the most comprehensive primary care to families and communities throughout Indiana, treating all ages from babies to the elderly. They also provide more years of primary care than any other specialty. These physicians are trained to diagnose and treat illnesses, apply preventive care tactics, manage chronic illnesses, and coordinate with subspecialists to provide continuous frontline health care that is efficient and effective.
You get a lot of continuity of care and a lot of familiarity in being treated by a family doctor.
We see geriatrics, we take care of chronic medical conditions in adults, we see children for sick visits.
We provide obstetrical care, well child care, preventative services. We do minor surgeries here.
I spent 4 years in undergraduate training, then 4 years in medical school, and then followed by 3 years in a family medicine residency program.
If we see somebody who we've known and taken care of for years, we can assess their problems quicker and cheaper and give them better care.
Even though studies show that comprehensive primary and preventative care results in better quality health care at lower costs for all involved, reduces the number of hospitalizations, and lowers mortality rates, the number of primary care physicians continues to diminish.
There's been an increasing shortage of primary care physicians and most critically family medicine physicians for a long time. And the situation's getting worse.
Our specialty is not on the higher paying scale, and so if students know they're going to come out, hundreds of thousands of dollars in the hole, they may be looking for specialties that are more lucrative.
We aren't turning out enough family physicians to meet those needs of those small communities, and many of those people in those small communities are going to have to travel farther and farther for their health care.
The need of primary care is greater than ever, and it's Indiana's rural areas that will be affected most by this shortage. By 2020, Indiana will need 2,000 additional primary care physicians to meet its growing health care needs.
There are over 50 counties in Indiana, of our 92 counties, that are medically underserved. So there's a great need.
To have an internist, a pediatrician, an OBGYN, and general surgeon is not possible for many small communities. So having a family physician is efficient, cost-effective.
There are several driving forces behind the state's shortage. First, the healthcare system is broken, and family physicians are continuing to be paid at rates 100% to 200% below other specialties.
The payment system is skewed so that the more you do, the more you get paid. The more you prevent, the less you get paid.
Our healthcare system values over-specialization, high-priced procedures, the most lucrative aspects of medicine. So medical students are choosing the higher-priced specialties and are encouraged to do so by our academic institutions.
We never used to think of ourselves as a business, but we're a business. We've got to keep the lights on. We've got to keep the doors open for the patients to be seen.
Second, medical students are choosing more lucrative specialties because of the financial debt they have after leaving school.
The debt burden of a family medicine resident is just as large as any other specialty, and the salaries of a family medicine doctor out of residency is about half, at least, of what any other specialty would be.
The family doctor offer was 3 weeks vacation, $120,000 a year. And the offer for the radiologist was $450,000 first year out, 12 weeks vacation.
Third, graduates entering family medicine have dropped from 20% to 9% in the past 10 years.
This year in particular has been one of the worst years since I've been faculty. We had about 25% less applicants compared to previous years.
The medical school is really great at exposing you to a lot of different specialties, but as far as family medicine is concerned, there's not much of a presence on IU's campus.
These issues can be resolved with support from legislators. The state needs to support the medical school expansion for the purpose of training more family physicians.
The other important thing the medical school can do to encourage primary care is to expand the medical school. But they need to develop a plan to have a physician workforce balanced with primary care and specialties.
The legislature should consider additional scholarships and loan forgiveness programs to encourage more students to enter family medicine.
I think that the state can offer scholarships and tuition payback programs that would allow students to really make a choice based on what they really love doing.
In order to meet the state's primary care needs, the state-funded medical schools should expose students to primary care earlier in their schooling.
Medical schools need to do a better job at exposing the student to family physicians by having them visit more often family practice offices and in different communities such as rural or urban communities.
The medical school should also actively recruit students from rural backgrounds and those who have strong interests in primary care.
A lot of people who come from backgrounds in rural areas or have familiarity with family physicians have been shown to go back and choose those type of careers.
Finally, the healthcare system needs to adjust the payment of services performed by family physicians.
Our vision for family medicine is that, payment systems are going to change so that we can be paid more for some of this coordination of care and not just on episodic care or just for seeing patients in the office.
Family physicians, as we talked about, do provide the full scope of primary care. And when you look at a healthcare system as ours, having a good, solid foundation of primary care is really the most cost-effective way to ensure proper care for all Americans.
This shortage needs to be addressed so that each Hoosier has access to a personal physician who will provide affordable and comprehensive care.